for this year? Like, are my kidneys okay? And I want you to ask yourself that. Like, if you just think back and ask yourself, are my kidneys okay? How are you going to measure that? Or how are you going to, answer that question for yourself, But it's more, I think it's more tricky when it comes to kids, Esther, that, if you're an adult, you can manage yourself, you know how to take care of yourself, but kids, I mean, most people don't think about kidney health when they think about children. Is there a reason why we're not bothered about kids having kidney issues, or, we're not really conscious about kids having kidney issues?
Thank you very much. So kids also get kidney problems, actually. And before I move to answer your question, I would actually like to say that the kidneys, as I mentioned earlier on, are actually being shaped. So when you take the usual beans that we eat, when you take a grain of it and you look at it critically, the shape of the kidney looks like that of the bean. Okay, and then the size of the kidney is just like your fist. So my kidney is as the size of my fist. Okay. So if you make a fist with your hand, that is the size.
That's the size
of your kidney. Yeah. So, like Doc said, the kidneys are very important. And in children, they are equally important. And I think most people do not think children have kidney problems because of probably lack of awareness about it. And unlike adults, where the leading causes of kidney diseases are hypertension or uncontrolled hypertension and uncontrolled diabetes, in children, the causes are different. Okay, so for children, the leading cause or causes are the congenital anomalies of the kidneys and the urinary tract of the kidneys.
It's big. You have to break it down, please. Break it What do you mean by that?
So the kidneys form part of what we call the urinary system. Okay. So in the urinary system, you have the kidneys, you have the ureters, you have the bladder, and then you have the urethra. Okay. So when the kidneys form the urine is actually stored in what we call the bladder. And then before the urine is stored in the bladder, they move through this tube to the bladder. Then these tubes are called ureters. And then when you want to pee, or the child wants to pee or wants to pass urine, it comes through what we call the urethra. Okay. So the urinary system, you have the kidneys, the ureters, the bladder, and then the urethra. So if a child has a congenital anomaly of the kidney and the urinary tract, it means that there's a malformation or there's a defect with this system, the whole system. And it's congenital because the child is born with it.
Okay. So there are some children who are born with kidney issues already.
Exactly.
Oh.
And I mentioned earlier on that the kidneys are supposed to be two. There are some children who are actually born with just one kidney.
Oh.
In real life, one can actually survive on one kidney. That is how come sometimes one can donate one kidney to a relative or a neighbor or any other person. You can live on one. That is if those kidneys are healthy.
Okay.
But in some of these children, the one that he or she is born with even has a problem. Okay, so the leading cause of this kidney disease in children is the congenital anomaly of the kidney and the urinary tract.
So those that are born with kidney issues or urinary tract issues.
Yes.
I see. If you're just tuning in, this is 107.9 Orange FM, and we're 15 minutes past 8 o'clock here on the Orange Health Lounge. And this morning, we're commemorating World Kidney Day by having a discussion about, kids, the population that we usually think about last. and this morning we're putting them first when it comes to kidney disease. Are you, interested in our conversation? Do you have a question to ask? If you do, send it by WhatsApp on 059393299305939329993. Just send it there. You can send it in a text or a voice note, and we will definitely read it out and play it for you. Kindly keep it short and simple. Dr. Akoi, so Esther says that there are kids who are born with, congenital kidney issues. How would you spot it if you're a parent and your child has a kidney issue? Are there any things that you'd see that would let you think that your child has a kidney problem?
Okay, so actually, whilst the child is in the womb, some of the problems can actually be picked up
on
ultrasound.
Nice.
Yes, so pregnant women go for ultrasound scan to evaluate how the baby is doing. That's yes. So
I thought they only went to check if it's a boy or girl.
Oh, not necessarily.
Which is what most of them go to look out for.
Yes. So usually when the pregnancy is around, like let's say 20 weeks, 22 weeks, they actually do what they call an anomaly scan.
An anomaly scan.
Yes. What essentially means is that they are going to do a very detailed scan of the baby in the womb, just to make sure that the structures in the baby have formed well. So yes, if you have a very good person who is well trained with the ultrasound, they can actually pick up some of the kidney issues when the baby is actually inside the womb and is yet to be born. Yes. So so that is one way in which they can be picked up. But then if the child is born, some of the ways in which the parents can know or see if the child has a kidney problem, there are certain signs or symptoms, as to say, certain features that the child would have. So, for instance, if they realize that the child is beginning to look swollen, so what it means is that usually the child will wake up in the morning and then you find out that the face looks swollen, especially around the eyes.
So the child has a puffy face in the morning.
Puffy face in the morning, and then maybe somewhere when it gets to afternoon time, you find it's going down. That is one indication that the child may be having a kidney problem. Another feature is that the child, when the child goes to urinate, you find that the urine is looking very, very foamy. Yes, so that would also be a pointer to a kidney problem. Or the color of the urine has changed. So either maybe the parents who see that now the urine is looking a bit bloody, or even if it's looking brownish, maybe like tea colored, or even like Coca-Cola, that could all point to the fact that there may be a problem with the kidney. Yes. Or if the child is complaining of persistent headaches. Headaches could mean a whole lot of things. Yes, but in children, if their blood pressure is going up, it can actually manifest as they complaining of a lot of headaches.
So we can check blood pressure in children?
Yes, we can check blood pressure in
I
children.
have never ever seen it being done in any hospital. If you're doing it in your hospital, good job. But I have never. Esther, do you do it?
Yes.
Or especially at the renal unit?
No, we actually do it, but how we interpret it is different from
the adults.
And then how you even check it is a bit different, because you have to use the right size of cuff. That cuff that we use in checking the blood pressure. For children, you have to use the right size.
The right size for the
child, based on the child's age. So it's a bit technical, and it's not the regular one we do for adults. And after checking it, you interpret it in a particular way to tell whether the child is...
they should train more renal nurses. Because, when you said, I was like, when was the last time I saw a child's BP being checked? Probably when I was doing house job at CAR. But, there you go. So your child can show signs, which you, the adult, should pick up.
Yeah.
Especially the puffy. After the puffiness, you should be able to see it. And
yes.
Yeah.
If your child is looking like a boxer in the morning, let me put it that way, you should be concerned that there may be something wrong with the child. But is there anything that the mother would do, or let me not be biased, or the father would do that would affect the child's kidneys, whilst they are developing? You don't think that will happen? Maybe some medication, something, because people wonder, when their kids are diagnosed early with something, that they ask themselves, what did I do when I was pregnant? Is there anything that an adult will do that would affect a child when you're growing?
Okay, so for children in particular, in terms of Kakuta, as I mentioned earlier, it could be due to genetic mutations.
Genetic mutations.
So, okay. Like it could run, in families or genetics.
Mm-hmm.
Then it could also be due to environmental conditions. For instance, if a mother is pregnant and takes in some medications, it's not every medication that is good for a pregnant woman.
Mm-hmm.
For instance, we have some medications called the ACE inhibitors.
Mm-hmm.
And if a mother who is pregnant takes some of these medications, it can actually affect the growth of the child, and it can actually affect some of the organs like the kidneys. So when we are pregnant, we are advised that, or when women are pregnant, the advice is that they attend the clinic early, and then even if they have to take in some medications, they have to be cautious and then take prescribed medications, because some of the medications are nephrotoxic. That means that they are actually toxic to the kidneys and to the child's kidney as well in the womb. And aside that, when the child is born, infections can actually also cause kidney diseases.
Okay.
Yeah, so an infection like a simple sore throat that we see as a sore throat.
Sore throat peh?
Yes. And sometimes people say lozenges, vitamin C.
Vitamin C.
Those ones are good, but those ones are just to soothing the throat, okay? But you have to tackle the bacteria.
But people take it so commonly.
Yes.
Oh, it's just a sore throat.
Yes.
Wow.
So because the germs or bacteria that cause the sore throats have some affinity for the kidneys, so they actually travel to the kidneys and cause problems. So you have to take an antibiotic. Antibiotic, it is that antibiotic that will actually uproot it, for lack of better word to use, to deal with it and kill the germs or the bacteria that causes the sore throat. And those antibiotics are very cheap to get. Okay, so I would say that instead of sort of pampering the bacteria and taking some lozenges and the rest, we should rather tend to seek help early. We should rather take the antibiotics that are recommended. If you go to the clinic, it will be very, very, very easy for you to get antibiotics prescribed by the doctor. Sometimes we run to pharmacy shops to buy some medications on our own, thinking that that may be cheaper, but doing the trial and error, you realize that you spend so much. But if you run to the nearest clinic near you, you realize that most of these medications are even covered by health insurance.
Okay.
They are so cheap. And even if they are not, the clinic closer to you does not accept health insurance. It's even so cheap to still buy them when they are prescribed. That is the right one.
The right one.
So you tackle it one touch and then you deal with it. And then the child gets well. But when we keep long in treating it, we try using this logic.
We're going to blend some ginger and pour in some honey.
Then it's getting serious. Before you realize the kidneys are affected, and then it becomes a big issue. Yes.
So, if you had there's something as simple and as harmless, let me say, as a sore throat, could harm the kidneys of your child. Dr. Akoi, someone is asking me that, are there specific drugs that pregnant women should avoid when it comes to kidney issues in children. He said, I'm asking essentially because when I was pregnant, I wanted to take a particular kind of medication so that I could eat well. But my nurses and doctors kept telling me to stop because they're not good for my child. He's saying that kindly let pregnant women know that not all medications can be taken in pregnancy. And if you can give us examples, we are listening to you. Yeah.
Yes. Okay. So drugs can have, several studies have been done for each drug to establish the effects that they can have on a growing baby in the womb. There are some that are notorious for causing harm to the development of the baby.
Okay.
So, for instance, like Esther mentioned, certain BP medications, which we say we call them the ACE inhibitors. Okay. So, example is like lisinopril, for instance, which is taken to control blood pressure. For instance, it's not safe to take during pregnancy. So that's how come when a pregnant woman has hypertension, she's not put on that, but she's put on other
medications,
blood pressure medications. Yes, some of the seizure medications to control seizures, for instance. So a drug like sodium valproate, for instance, is taken to if someone has a seizure disorder, it's taken to control that, but it's not safe.
It's not safe when you're
pregnant. Yes. So I think that the general rule is that if a pregnant woman is unwell, it's best for her to go to the hospital to be seen by an obstetrician who will be able to prescribe the medication.
The right kind of medication.
Safe. Yes. And then as much as possible, in fact, herbal medication should be avoided for pregnant women and even for children in general, because earlier you asked about some of the things that parents do. So, for instance, giving your child herbs, for instance, is something that, because you don't know exactly what chemicals are contained within the herbs, and some of them are very, very toxic to the kidneys.
But let me play devil's advocate. Usually when we say, parents say, kura bi na wasa na manom na me fever na teko.
In terms of herbal medications, it's not like we are generally against herbal medications, because some of the orthodox medications that we take, the regular paracetamol and the rest, they are actually extracted from herbs.
Oh.
Yes, but you realize that with the herbs, you have the good aspect, or what we call the medicinal aspect, and then you have the poisonous aspect
of it.
Okay, so if an orthodox medicine is done, it means that the medicinal aspect is extracted from the herbs, and then it is prepared to get medication. And even that one, when you the prescription is given, or you are told to take that medicine, you are told take it morning, afternoon, evening, or only morning and evening for probably just 3 days. Then you stop, because even with that one that has been done scientifically, that has shown that it can cure a particular disease. When it is abused, it actually becomes toxic to the kidneys. So scientifically, you take medications for a period of time. Sometimes you are told to come back to the hospital for review. So as you are reviewed, then sometimes it is adjusted for you. So it is not that we are totally against herbal medications, but those that prepare it and they don't prepare it well, they don't do it scientifically, they end up boiling the medicinal aspect and the poisonous aspect all together. So whilst you are taking it and it's as if it is curing you, it is also affecting some organs in your body, like the kidneys. Okay, so in order to avoid those complications, we frown on it, that do not take it at all, because it has not been done scientifically. Unlike recently, that I think KMUST is into plant medicine. So they also do it scientifically, exactly, for particular indications or diseases. Okay, so in terms of herbal medicines, it is because those who do it, the quack ones, yes, they don't do it well, and it becomes toxic to the body.
So I mean, let's just be careful, like Esther has said, like you have to be cautious when you're giving things to your children. Even if it is the one that has been prescribed, you have to go according to. Dr. Akoi, someone says, kindly ask Dr. Akoi for me that are there children who have kidney disease that is silent until they become adults? That's that's an interesting one. Yes. Is there a child who may have a kidney issue and it will not show up until they are older?
Yes, so there are some children who begin to leak proteins in their urine.
They leak proteins in their urine?
So let me explain that. So what happens is that the kidneys are such that when they filter the blood, it's like in a layman's way to explain, it's like when you're making palm nut soup, and then you finish pounding the palm nuts and mix it with the water, you strain with a strainer. So it's similar to that.
So the kidney is like a filter, isn't
yes,
it?
So it's like a sieve of some sort. Yes. So there is such that it doesn't allow certain substances to move from the blood into the urine. For instance, these proteins I'm talking about. Yes. These proteins, when they find their way into the kidneys, okay, when the kidneys are started, there's a problem with where the filtration happens, and then it leaks into the kidney, what we call the kidney tubules. It can actually cause damage. So over time, so you can have someone who's been leaking protein for quite a long time. It goes undetected. It doesn't leak a lot to cause him to become swollen and all that. But over time, these proteins actually damage the kidneys, and then they cause the kidneys to they get a lot of scar tissue in the kidneys, and then before you realize, maybe he gets into the late teens or early adulthood, and then he's now coming with what we call a chronic kidney disease, where now the kidneys have shrunk so much that they are not able to function well. Yes. So that's one of the ways.
That's one of the things that it can be.
That can.
It can be there, but it can be like in the background.
Yes, and then it will just be developing, and then later on, it can manifest that way.
I mean, I'm asking all of this because sometimes we have. Let me leave it at adults who sort of wrongly advise people when it comes to their health, okay, because something they may have heard or misheard, and then they transpose it to people, because someone would think that, maybe someone is 19 years and they have a kidney issue, and they say, but you can have it, like Esther has said, it can be congenital, it can be born with it, or it could be something that may have been happening over a period of time, and then when you grow up, then it shows itself. Okay, Esther, someone says that I heard we don't give paracetamol to children, but when we were younger, our parents would mash their paracetamol and give to us when we had headaches. She's saying, is that safe?
In fact, the paracetamol is actually kidney friendly.
Okay.
It is rather the liver that, if it's diseased, you do not give paracetamol. So, but in giving to a child who has a kidney problem, or any child who wants to take paracetamol, it's safe. But then again, you'd have to follow a prescription. And in everything, we usually say that moderation. Okay, so if you have to, your child has fever, as we all know, we educate our mothers that you tablets sponge, give a dose of paracetamol, then you quickly rush the child to the hospital. Okay, so once you get to the hospital, the doctor may do series of investigations, including probably a blood culture. You could maybe screen for malaria, series of tests. And then based on the findings that the doctor will get, then a proper prescription can be given that, okay, this child will need paracetamol or may even need something in addition to the paracetamol. So the idea is that we shouldn't abuse it, okay? If it becomes necessary and you have to, maybe at dawn, 2 a.m., your child is spiking, has this high fever or high temperature, you can actually give a dose of paracetamol. Then you quickly rush the child to the hospital, but do not abuse it. Moderation is the key.
If you're just tuning in, we're 36 minutes past 8 o'clock here on 107.9 FM, Orange FM. This is the Orange Health Lounge, and this morning, as part of the World Kidney Health Day celebrations, we're discussing kidney health in children. How healthy are your kids' kidneys? Have you ever bothered to find out if your children's kidneys are doing okay? You know, has it ever? I don't think it's crossed your mind. If it hasn't, I think today, you know, listening to the conversation, it should worry you. It should cross your mind that, I mean, don't say, oh, I won't check. If I find out, what do I do? Check. If you check and there's nothing wrong, then you know there's nothing wrong. But if you check and something can be found, you know, then you know that, all right, this is something that's, you know, I need to see someone about. Like Dr. Akoi said earlier, your child can have kidney illness and it may be silent. You may not see anything. Your child may go about their daily life normally, but it will be in the background. And then there are those that, you know, you see obviously that this child is unwell and you need to take the child to hospital. You can join us this morning on our conversation on 059-3932-993. That's WhatsApp only. Just send your text, send your voice note. How much do you know about kidney disease when it comes to children? How much do you care when it comes to your child or the child that you're taking care of, you know, their kidney health? Good morning to you, PEK Mate 07. You're watching us on YouTube. You're saying good morning and that you're loving the program already. Thank you for doing that. Good morning to all those who are watching us on YouTube and those listening to us in their cars or from the comforts of their homes or on their devices going about their Saturday. This is the Orange Health Lounge, and as always on Saturdays we talk about healthcare issues. So 05939329993. That's WhatsApp only. Like someone has sent this. Say good morning. Thank you for saying we're doing a great job. So then my question is that how does the environment put children at risk of having kidney disease? Yes, I think there's something that I want to ask both of you. Usually, you know, I don't know if it's changed now. I don't know if it's changed now. This from Focus. So Focus, I hope you're fine. I don't know if it's changed now, but some time ago, we used to have a lot of kids from farming areas coming with kidney issues, and at that time, I don't know how we made the link, but we used to say, oh, some pesticides, some spray, something. How does the environment that the child lives in, like how does it contribute to like how their kidneys function?
So the environment, there are certain pollutants in the environment that are very toxic to the kidneys. So for instance, the use of certain pesticides. So the child is from a rural place. They do a lot of farming. They use a lot of pesticides. Sometimes the parents don't keep these well. Children go to pick them. They drink, and they suffer a lot of toxic effects from these pesticides. We've had a few instances where children actually have died from these ingestion or taking in these pesticides. The kidneys just fail and shut down, liver fails and shut down, and then they are unable to survive. Another problem is with, now there's a lot of talk going on about galamsey issues and all that, and a lot of exposure to what we call heavy metals, which are used in some of these illegal mining sites. And we have children who are who work there as laborers, yes. So they having exposure to these heavy metals actually are also very toxic to their kidneys. Another very common thing is malaria.
Oh.
Yes, malaria is one of the leading causes of kidney injury in children.
Oh, this is our friend malaria.
Yes, so the malaria actually causes the child's, what we call the red blood cells, to break down. So the child's urine will change color and so start looking like Coca-Cola. And once that happens, what it means is that we call it hemoglobin. I'm sure a lot of us have heard of hemoglobin. Yes, hemoglobin is very good. It's in our red blood cells. It transports oxygen around our bodies. We need it to survive. But if the hemoglobin gets into the kidneys, it is very, very poisonous to the kidneys. So it happens like that, and then it starts to damage the kidneys. And if the parents do not, bring the child to the hospital, the child can actually die from it. We actually do a lot of dialysis for children who get kidney injury from malaria. Yes. So it's very, very important for parents to be very cautious. Use insecticide-treated nets at home. Let your children sleep in insecticide-treated nets. Do not let them go out in the night to be playing around, getting bitten by mosquitoes. Keep the surroundings very clean. Weed the areas. Make sure the gutters are not choked and all that. Just get rid of the breeding sites for the mosquitoes, because malaria is one of the leading causes of acute kidney injury in children. And it's that we've actually seen children die
from malaria,
kidney failure from malaria. Yes.
So you see, a small friendly mosquito, a small friendly mosquito can be not so friendly when it comes to kidney health. But people are really surprised that children can be affected by kidney disease. I keep getting the message, and I keep wondering why people are surprised that, because usually when you hear about kidney, you think adults. You see some adults and like, oh, wait, your kidney. But people have never, and I get the same reaction when we talk about children with cancers. But like, now cancer, then what crime has a child committed to have kidney issues? Okay, and there's a parent who has sent a message saying that my child was diagnosed with a kidney challenge young. However, my child did not have any swelling of the hands or feet. So it was actually found when we went to hospital routinely. So it can just be found.
Yes, and that's the recommendation, that we should do regular checkups for our children, not for ourselves alone, but for our children as well. Okay, ideally, if your child is celebrating his or her birthday, after the parties,
after the cake,
exactly, you can simply do simple checkups, like particularly for the kidneys, you can do what we call the urine dipstick.
Okay.
So we actually take a sample of the urine. Okay, and that sample of the urine, if you do that test, it actually gives you a fair idea of how the kidneys are doing. Just a simple urine test.
A simple urine
test will give you a fair idea of how the kidneys are doing. And then if there's any problem, then we'll go further. To investigate.
I sometimes see how parents struggle to get their kids to pee into the urine container.
It can be very, interesting and fun for the kids, depending on how you go about it.
Okay.
My children, some time ago, I wanted to do urine dipstick for them, and then for the first two, they were able to produce urine for me. So I took it. The last one was so excited. He also wanted to do it, but then he didn't feel like peeing. So he actually ran to the bathroom to get water. Can you imagine? Because so he also wants. So it can be very exciting, and depending on how you go about it. And it's so cheap.
Okay.
Very cheap. You can walk to any lab and then you tell them you want to do a urine test or urine dipstick, or you come to us
at
the
hospital
and we'll do it for you. Very cheap.
Okay, so the urine dipstick is very cheap. It's a tableside test. It doesn't take more than 2 or 3 minutes to get a reading, and I think it's a basic screening. That's how I wish that during this year's celebration you had some plenty money, and that you would donate urine dipsticks, and I'll come for some for my hospital, so we can be running some of these tests for free. But are there any activities that children do that can put them at risk of kidney disease? The children themselves now.
Okay, so in terms of, let's start from maybe as babies. Even though it's not through their own efforts, because of the diapers and particularly diaper that mothers use for their babies, sometimes they are not changed regularly, and then they get soaked with urine. They keep it on for a very long time, and bacteria actually grows in a moist and warm environment. So that environment actually creates room for the bacteria to grow, and then it travels. From the beginning, I talked about the fact that you have the urethra, the bladder, and so that infection or that bacteria can actually travel through the tract to the kidneys to actually cause a kidney disease. So we advise that as babies, nowadays, the new issue is diapers, but then the diapers must be changed regularly. And then as they grow, as we do toilet training and the rest, we have to teach them that, especially girls, you have to wipe from front to the back. Because the urethra is such that for girls, or when you grow, women, it is short, unlike boys, so it is very short. About a 2-year-old child's urethra, a girl could be like 2.3 centimeters only. Whereas a boy's own could be like 5 centimeters. So for girls, it's very particular. If you have a girl child, you train them that they have to, after peeing or even after using the washroom, they have to wash and clean themselves from front to the back, so that bacteria around the anus or the genital area will not travel through the urethra then to the kidneys. So at that level, that is, and then as they grow, as adolescents, puberty girls, they would have start menstruating and the rest. Hygiene is very, very important. They have to keep their genital area very clean all the time, so that you don't have infections, traveling. And then even when the infections occur, what we do, our health-seeking behavior, what we do, if the child is not well, let's train our children to confide in us when they are not well. So once they inform us, then you quickly make the necessary intervention. Go to the clinic, go to the hospital, the infection is treated, and the child is well. Otherwise, when we keep it ongoing, it takes long, then it becomes complicated. And that. And then, so basically. That's it. Yes.
Okay, so good morning to Gina. Gina is saying that my son does not like to pee. Says that he will store urine from home to school, and sometimes he will come back and he has not peed. Dr. Akoi, is this healthy behavior in children? Because I know there are some kids like that. They don't want to pee anywhere but home.
Okay, so it's important for the mom to actually find out what the reason is. Is it that he's struggling to pee? Because there are some of these congenital malformations whereby there's like a blockage where the urine is supposed to pass out. So when the child is going to pee, he strains to pee, and then not a lot of it will come. So it could be that it's just a habit that a child has, which is not good. But then it's important to make sure that it's not like a problem that is there, that the child is having difficulty urinating, or if when he's urinating, does he feel pains? that could be the reason why he's hesitant to urinate. So all of these are things that the mother needs to find out. But if there's nothing of that sort and the child just prefers to keep the urine and doesn't want to urinate, then that is dangerous, because if the child is not urinating frequently, it means that he's putting himself at risk of getting what we call urinary tract infections.
Okay.
Yes, because when the urine stays, urine is meant to come out of the body. It's not meant to stay inside the body. So when the urine stays inside the body, then that is when germs, which we call bacteria, tend to, grow and multiply inside the urine, and then the child will now have what we call a urinary tract infection, which can be very dangerous, because like Madam Esther said, if the infection, it will start in the bladder. If it travels upwards and it goes into the kidneys, it can actually cause what we call scarring in the kidneys. We all know what a scar is. You get a wound and then it heals and it leaves a scar behind. It can actually cause scarring within the kidneys. And once the scarring happens within the kidneys, then it means that those portions where the scars are in the kidneys are damaged and they can't be regenerated. And then later on, the child will now start having hypertension and then go into kidney failure. And then now we are talking about dialysis and kidney transplants and all that. Yes.
We'll come to those complications or those high things in a bit, but let me announce the phone lines again. 0593932993, 0593932993. How healthy are your child's kidneys? Are your child's kidneys, okay? Okay, are your child's kidneys okay? Are your child's kidneys functioning perfectly? And if you don't have the answer to that question, that is what should trigger you to, take your children to hospital. It's like Esther said, it's just a matter of doing a urine dipstick, nothing more. It's not, no injection, no needles, nothing. It's just pee into a container. They put in a very nice, piece of paper, and then they will interpret it for you. It's not expensive too. If the nurses are really kind, they can do it for free. If the nurses are really kind, they can do it for free. But someone is saying that, will you link spirituality to kidney diseases in children, as many do when it comes to adults? I don't know what your experience is. You are in kidney health in kids. I know, I think I have a discussion on this show in a couple of weeks about spirituality and health, but do people also over-spiritualize or spiritualize kidney health in children?
Yes, they do. In fact, before I answer this question, I just want to add a bit to the boy that the mother says he doesn't like peeing. I think the mother should also try to encourage him to take in a lot of water. Okay, so whilst he drinks in a lot of water, the bladder will certainly be full, and he will certainly want to pee. And even taking in a lot of water is good for the body, and it's even better and good, very good for the kidneys as well. So we could start by, not drinking a lot at a go, but in bits, and then gradually he may even like to drink water more often. All right, so back to the question of spirituality. It's very common. It's very common. In fact, in our part of the world or in our part of the country where most people attribute a lot of things to diabo and other things, as if some say it's a curse. When they see that their children are edematous or swollen, they think it's a curse. Others think it's because of the sins of the parents. That's why the child is not well. And most of the time, in fact, most parents would actually start the treatment of their children from the spiritual centers. You realize that they come to the hospital and you do a very good assessment. You ask questions, and most of the time, the mother or the parent will tell you that when it happened, they sent the child to either a herbalist, a spiritual leader, and then when it becomes serious or they don't get results, as they would want to, then they come to the hospital. But I think it also is linked to our health-seeking behavior, in that most of the time people would want to do their own cultural or spiritual aspects of, healing before they move to the hospital. So it is true. Most people actually attribute kidney disease to spirituality, and sometimes when it fails before they move to the hospital. But usually our advice is that sometimes even at the hospital they will say that you should discharge them to go home, because with the treatment of kidney disease it takes time. Okay, so they come one day. It's not like malaria that 3 days you see an improvement, the temperature has subsided and all that. No, this one, it takes time, sometimes 6 weeks before you see any improvement. So when they are not getting the results, then they are like, oh, they want to go home, they want to go to the pastor, they want to go and pray about it. But we encourage them that, see, you can pray about it at home, whilst we also continue at the hospital. So we can do both. So usually that is how we are able to, jojo, and then we come to a midway, and then we are able to solve the problems of the children.
All right. And if you're just tuning in, this is 107.9 FM. Good morning to you, Elvis. I hope you're doing well. Elvis, your question is very important. Your question is really, really, really important. Okay. So this is what Elvis says. Elvis says that my child, on the other hand, does not like drinking water. Saying that no matter what I do, he will not drink water. Saying that we are both listening to your show this morning. Always, my doctor and nurse will not scare him. He's saying, what is the best strategy to get this child to drink water? Dr. Akoi, there are some kids like that. It doesn't matter the fanciness of the water bottle or whatever. They just won't drink the water. They just... I'll be sorry, okay? How do you convince a child who is not interested in even drinking a bottle of water in a day to drink water? Wow. Oh gosh, it's interesting. It's interesting, but
very interesting, and you need to have time. You see, sometimes I wouldn't want to conclude that we are not patient, but unlike adults,
we are not patient. We are not patient.
Unlike adults, where he or she understands what he has to do, but for the child, he doesn't understand. So you need to take. You give it to the child. It doesn't take it, but don't give up. Don't give up. Try and put it into something, a bottle that looks very fancy, very nice, and then it takes time. Today he doesn't take it. Tomorrow, try again. Begin to conscientize his mind about the benefits. Okay, children can be very intelligent sometimes. You tell them, you drink this one, these are the benefits, these are... By and by, regularly, you see that then you start drinking. Those are a little bit of, tidbits and other things that you
but can they put it, let's say, fruit juice? What about juices?
The problem
those ones have water in it, isn't it?
The sugar content. Okay, yeah. The problem with juice is the sugar content, because if that one too becomes too much, then it becomes also detrimental to the body. So plain water is ideal. Ideally,
plain water.
Yes.
And just to add, positive reinforcement works.
Okay.
So if Elvis can find a way, like a form of a reward system, like let's say if you drink this small bottle of Baltic, maybe we'll go and do this, or I'll get this for you, and all that. It also helps to be able to try to sort of get the child to actually drink the water. Yes. So if he can put a small form of reward system in place, sometimes parents who try that say that it works. You have a child who doesn't like cleaning his room, and be like, okay, so if you do clean, then maybe we'll go and get this, or maybe we'll go and do this, and all that. So he can also try that to see. I remember when I was a child, I didn't like fufu at all. And unfortunately, my dad too was a type who likes to eat fufu every day. So it was always an issue, when my mom didn't want to, I had now have to go and cook rice for him and all that. So they had a reward system in place. If I'm able to swallow this number of food, they get. So it's something that that helps.
Okay.
And I think children also observe us a lot. As parents, what we do, they copy a lot. So if you want your child to drink, I think he or she should also be seeing you drinking a lot of water.
It's true, okay,
yeah, and then they'll copy it, and then before you realize they are also.
Because if you, the adult, you're not doing it, then what's the point of the child doing it? So please, Elvis, I know what you like, but you can't drink that at home. Or your child is going to copy. I know what you like, but your child's going to copy. It's 9 o'clock, and let's go and make some money. So I know a lot of people wonder about home care services for their older relatives or even kids that need support. Let me give you some assurance and some relief. Now here in Kumasi, we have Integrity Care Services. That is a trusted provider of home care for sick and elderly. It's a comprehensive home care service that provides home care and professional physiotherapy, in the best of locations here in Kumasi, and they can also do it in the comfort of your home. Integrity Care has a care home which provides a conducive and supportive environment to promote healing, comfort, and overall well-being for those who need it. So Integrity Care Services also has eye care, mental health, ENT services. They have resident doctors and nurses, home care visits nurses. They have lab services. They do wound dressing and dietary management, as well as pharmaceuticals. You can locate Integrity Care Services. Their main office is at Kwadaso, behind Siloam Hospital, and then the care home is located in the serene and quiet place of Ejiso Sewe Kra. If you want further inquiries on how you can get in touch with Integrity Care Services for your loved ones, is 050-1919-191 or 050-300018. And that's Integrity Care Services, located right here in Kumasi, offering home care and home support services to people who are sick and the elderly. I think this is a really good service, and you can call them once again on 050-1919-191 or 050-300018. So Petra, thanks for doing the listening every time. Petra is asking that, can you also give your child fruits containing enough water if the child is resisting drinking water? Yeah, sometimes people say you can give watermelon or something, but does it contain enough water that your child needs? But let me ask, how much water is enough water for your child during the day or in 24 hours?
So generally, we have what we call maintenance requirements for a child. Children are growing, so their weights change as they grow. So a lot of times it depends on the age of the child, depends on the weight of the child. That is what determines that. So for instance, if you have maybe a child who is 10 kilograms, for instance, he may need like 1 liter of fluids a day, which is what his body requires. Okay. So for that one, it usually depends on the weight of the child. Unlike in adults, where we say an adult should take like 3 liters in a day. For children, it varies because they are growing, and it depends on their weights.
And I think what will let you also know whether the child is taking in adequate water is the color of the urine. Okay, so if the child pees and it's a very deep yellow, then it means it's a bit dehydrated. He's not taking in enough water. Okay, so the urine is supposed to be colorless. Okay, so, or amber. amber to colorless, sort of. You know, sometimes when you've not taken in enough water and you pee and you look at it yourself, you realize that it's very deep, you know, but when you've taken in enough water, it's more or less colorless. Okay. So I think you could also observe the color of the urine, and that will give you an indication to see whether the child is taking in enough
water. Okay, but I mean, but the whole point is that for adults whose children are struggling to take in enough water, have you asked yourself if you are taking in enough water? Good morning to you, Nanekia. I say that do the parents like drinking water? And says it could be a family competition. That is not bad. Let's see who drinks like the most water today. Yeah, I think that's a very good positive reinforcement. You know, I think it's a very good positive reinforcement. But so after, you know, you know that your child probably, or a child is diagnosed with a kidney issue, what happens next? So you've come to hospital, they say your child has a kidney problem. Does it, you know, now Ghana, when we hear kidney, we think dialysis. Is that what it is also in children?
Oh, not necessarily.
Okay.
So there are different kidney issues that children come with. For some of them, they have a kidney issue because they are dehydrated, or because you know they don't have enough fluids in their body. In that case, we have to give the child fluids. There are some of them that the kidney issue is such that the kidneys themselves are not really working so well, so they are retaining a lot of fluid in their body. In that case, we have to give them medications that will help them to urinate a lot to get rid of that. There are some kidney problems that the child comes with, and we have to give the child different medications. Some we have to give the child steroids to try to treat that. Some of them can come with hypertension as a result of the kidney problem they have. You have to put them on hypertension medication. So the time that it will get to dialysis, that is more like when it's actually gotten very, very severe and very serious. So a lot of times we try as much as possible not to get to that point. So even with the dialysis, we have what we do for those who have an acute kidney issue. And then also if the kidney problem has become chronic. Yes. So it's not every kidney problem that will need dialysis. It's only those who have what we call kidney failure.
Kidney failure?
Yes. Okay. When the kidney has actually failed, and the measures that we have put in place to try to correct the problems or to try to get the kidney to work, those measures have also failed. Then that is when we know that the kidneys are not able to work. So then we have to use the dialysis, so that the dialysis sort of takes over the functions of the kidney. The thing about children is that if they get an acute problem with the kidney and the kidneys are not able to work acutely, the dialysis is able to take over the functions of the kidneys temporarily, because the kidneys are such that they are able to recover from an acute problem. Yes. So if it is an acute problem that the child has, in other words, the kidney injury is less than 3 months. Yes. So in that case, the kidney God has designed it in such a way that it's able to recover itself. If it gets injured and it starts to fail, it's able to recover. The only time when it's not able to recover by itself is when it has become chronic, which means that the damage has gone on for a long time, usually for more than 3 months. For that one, the kidney itself will not be able to recover. So in such a case, the patient would eventually, if it's gotten to what we call end stage kidney failure, the patient will eventually need a kidney transplant. So in such a patient, you have to be doing the dialysis for the meantime whilst you are making arrangements to be able to do the transplant.
But once we're there, is dialysis for adults different from dialysis for children?
So we usually have two main forms what we call peritoneal dialysis, what we call hemodialysis, or we call the extracorporeal dialysis, which in the dialysis is happening outside the body.
Outside the body.
For the peritoneal dialysis, the dialysis is, we are doing it within the patient's body. Yes.
Okay.
So it depends. Usually when a child comes with an acute kidney problem, acute kidney injury requiring dialysis, the first that we do is the peritoneal dialysis, because that's simpler to do, it's less expensive to do, and it works very well.
Okay.
Yes, so that is what we do for them. And most of the children that we do the peritoneal dialysis, what they actually do well. The kidneys are able to recover, they start producing their own urine and all that, yes. So the hemodialysis here in Pomfanochi, we usually reserve that for those who have the chronic, where the kidney has no chance of recovering on its own. So they are the ones that we tend to do the hemodialysis for, where we have a machine that we run the blood of the child through the machine, and then the machine sort of cleans out the blood, removes the excess water, the waste products, and all that, and then pumps it back into the child's body. Yes. So they are the ones that we usually reserve the hemodialysis for, as we sort of try to make arrangements to get them a transplant.
Sorry.
Yeah.
For the nursing aspect, or as nurses, what we also, in addition to what Doc said, what we also do is that we, in terms of fluids, when we realize that the child's kidney disease is related to the fact that he or she does not have enough fluid in the system, like in terms of dehydration, we encourage that the mother, for instance, let's say a primate who has given birth and is doing exclusive breastfeeding, but then she's not able to produce a lot of breast milk. This child could easily get dehydrated. So as a nurse, I will encourage the mother to try as much as possible and breastfeed. Because the more you breastfeed, the more the breast milk comes and the more fluid the child gets. And if it becomes critical, do not hide it, or do not stay home trying to ensure that you get the breast milk before. We've had a situation where a baby actually went into kidney failure because the mother did not have enough breast milk, and the child was really dehydrated, and then he ended up getting kidney injury. The blood test shows that the creatinine was just moving high. So it's basically because she did not know what to do. That was the first time. I mean, her first child. Yes, and she didn't know. And sometimes due to diarrhea and vomiting, children lose a lot of fluids. And when they lose these fluids, they become dehydrated. And then the dehydration can actually lead to kidney disease. So we encourage mothers or parents to actually, and then sometimes too, when these children are sick, because they are not able to produce urine, there's accumulation of fluid in the system. So they become edematous or swelling, like we said, and sometimes some of the fluids are around the lungs and they are not able to breathe well. So as nurses, we educate them, or we ensure that they restrict fluids. So sometimes we tell them that you can take just about this quantity or amount of water in a day. So we ensure that that is done. We also educate the parents on the medications that have been given to their children. Tell them that this, and this is the reason why these medications have been given, and you need to let your child take it regularly or religiously, and that it will help the child. Sometimes we also tell them that, the usual thing when people are not well, they go for coconut water, sometimes banana and the rest. But we give nutritional advice also, because if the kidneys are not functioning, the potassium is so high, what we call hyperkalemia. And then if you do not educate the mother, he may probably go and buy coconut water and try and give to this child, which will make the situation worse. So we give nutritional advice in collaboration with the dietitians as well. And then sometimes with pain management, we are able to do, we distract sort of in terms of you can sometimes give tablets to the child to play. Yes, in addition to the pain management medications and sometimes television and other things. So together we do that to manage the patient.
But Esther, so if somebody's listening and they've never bothered, let me put it that way, to check their kids' kidneys, and they come to hospital and they meet you, what should they say? You know, usually when people come to hospital, they say, "Oh, I'm coming for my checkup." Yes. Everybody looks at you like, "You have money, eh?" I went to do mine recently. I went and like, I'm coming for my annual checkup, and the lady at the reception said, "You must be very rich." And I said, "No, it's an insurance requirement." Yes, but so my child is okay playing, being a child. And I say, "You know what? I've heard this on the radio." I walk the child into hospital and I meet a nurse. What should the conversation be?
So ideally, if you meet me, I will welcome you very well, and then ask why you have come to the hospital. Then you can simply say you want to do a kidney test or a urine test. Okay. Usually we call it the kidney function test, but if you do not remember, just say you want to do a urine test or a kidney test, or you want to see how your child's kidneys are doing. Just that alone will tell us, give us an idea of what you actually want to do, and then we'll do that for you.
Yeah. Okay. It's 17 minutes past 9 o'clock here on 107.9 Orange FM. Shout out to all my guys in Cape Coast right now. Some are doing the listening. Yes, today is my school's homecoming, and people are still asking me why I'm in Kumasi and I'm not in Cape Coast. I will join online. I'll join online. But let me announce the phone lines now. You can join our conversation. Okay, you can join our conversation on 0541 022318, 0541 022318. Dr. Akoi, someone is asking, besides Confanoche, which is a very popular question I get, where else do these kidney people for children, like where else do people, are you in the districts, are you, besides Confanoche? We all can't come there. Because if somebody's listening and they need your services, but they're outside Kumasi, how do they go about attending clinic, in the renal unit? Let me pick this call and then we'll come to you in a bit. Hello, good morning. Hello, good morning.
Hello, good morning.
Good morning. Good morning.
Good morning, Doc.
Yes, your name and where are you calling from, please?
Yeah, I'm Philip from Aweduakwa.
Okay, Philip, go ahead.
Yeah, my question is, when you read portions of the Bible, either Ezekiel and Revelation there, but the Bible said we can eat the fruits of the trees and use their leaves for our health. So I'm wondering how now, if we use the leaves for our health, maybe your nurse was saying some of the leaves or the herbal that you contain some other toxins. So I'm wondering how a wise God who planted the trees asks his people to eat the fruit and use the leaves to cure their disease. So I was a bit confused.
Thank you very much for your call. I really appreciate this. 0541 022 318. That's the number to call us on and also ask your question. Esther?
Yes, please. Yes. So, maybe I can also give a quotation that for lack of knowledge, my people perish. Okay, so God has given us wisdom, He's given us knowledge to know how to go about using these herbs to help us. You see, even the common ingredients we use at home, it's not every part of it that we use. Even, let's say, carrots, you take some part of it, the head, the sprouty aspect, you take it off. You do not use it. Let's say apples. Apples are very good, very healthy, but the seed in it is poisonous. You don't eat it. Okay, basic things we use at home. Banana is very good, but then you don't eat the whole banana with the husk and everything. You see, so it depends on how these things are prepared. True. If they are done scientifically, why not? And not just done scientifically also, but then also research has, looked at it over time. They've been tried and tested. And we should value our lives. We should sort of, whatever goes into our body should be very important to us. Okay, so you wouldn't want to go, and some of these herbal medications, there's no inscription or anything on it. You don't even know what is in it, and you just drink it. It's like you are gambling with your life, So I would advise that you go for the one that has been done scientifically, that one that has been tested and tried, and then you live a healthy life.
Philip, even if it's herbal, there are very, very good, very, very good herbal medication products that have gone through a lot of rigorous testing and they've been shown to work. One of my very good friends, Dr. Boateng Ima at Kokofu, he has a lot of his products tested at KNUST, and the last time he sent me a picture of, I think, his wound dressing paste and what it has done, I was shocked. But this is a herbal-based product. So if even we are going for herbal, let's make sure that what we're going for is properly validated, is properly tested. Like a good friend of mine always says that snake poison is also natural, but it can kill you. Snake poison is 100% natural, but it can kill you. So yes, all the lemongrass, the pineapple bark, and orange peels and all those things, they may have some efficacy, but don't overdo it. And when in doubt, always seek professional advice, especially when it comes to your kidneys, and more especially when it comes in children. Nanekia says that I keep calling Nanekia, sorry, a doctor. That luckily for us, we have a good number of pediatricians around in the various districts who can manage kidney issues, and they refer to Konfanochi when they have maybe equipment need or something that cannot be done at their level. And like telemedicine consultation also goes on. 0541 022 318. So Dr. Akoi, so I don't know if the kidney ward is still, I think, was it B4 or something? It's still B4.
Yes, it's still B4.
Has it been renovated yet? Or B4 is still B4? The eternity, nothing has changed. Oh,
it's in
B4.
The pipeline. In fact, the Hill Cat project. Yes, it started from A block, so very soon
you come to B block.
Yes.
Please, let's advocate so that they do B4 first. I have a lot of good memories at B4. So after your child has had the diagnosis of maybe an acute or chronic kidney illness, then what happens next? People won't allow you to talk. Let me answer this. Let me pick this call and then I'll come back to you. Hello, good morning.
Fine, how are you?
I'm doing well. Yourself?
Fine.
Yes, kindly go ahead, sir.
Yeah. Calling from Orange.
Yes, this is Orange.
Yeah, I'm calling from Asamai.
Okay, kindly go ahead, sir.
Yeah. Like somebody mentioned that you take the fruit and use the leaf for treatment. I'm being convinced that any byproduct of a fruit which is taken by animal can also be taken equally by man or human being. How can you ascertain it?
Okay. We will attempt to answer your question. Thank you very much for your call. 0541 022 318. Dr. Akoi, let me come to you before I pick my next call. So after the diagnosis is done, then what happens? If it's acute, if it's chronic, what happens?
So if it's acute, it's again, it depends on what the diagnosis is, because it's the diagnosis that's going to determine how the treatment is going to be. Yes, but what we do first is actually to sit with the caregivers and then counsel them extensively about what we have found from all the assessments we did for the child. When we examine the child, the history, the lab results and everything, and then we tell them what the management plan is going to be. So for instance, if you pick maybe one of the common conditions they get, what we call nephrotic syndrome. Yes, if you pick that, for instance, we let them know that we'll have to put the child on medication, steroids maybe, which they'll take for 6 weeks, and then afterwards, we'll step down the dose. So we let them have an idea as to what the treatment modality is going to be. What medications are we going to give? How much of it? How often? How many times in a day is the child going to take the medication? What time of day is the child going to take the medication? We let them also know about things that they can do. So, for instance, if the child is hypertensive, we let them know that we have to restrict salt in the diet of the child. Sometimes we even have to restrict the amount of fluid the child takes. We calculate all that and let them know that maybe in the day the child should be able to drink this amount of water, or shouldn't take the salt and all that. And then we let them know. So based on the diagnosis again, we let them know what they are to expect. So for instance, again, a condition like nephrotic syndrome, it comes and it goes. So the child comes with it. We give them the medications, we treat the child's swelling and everything will go down and everything, and the parents are very excited. But we let them know that it's very likely that it will come again. That is how the disease is. It comes, it goes, it comes, it goes, till a point where now it doesn't come again. So we let them know also what they are to expect, in addition to the treatments that we are doing, so that they have a realistic expectation of what the child has and then how it's going to look like for them from the diagnosis to the treatment.
So then parents get a fair idea what they are going to go through during that treatment.
Yes.
I think that's fair, isn't it? I think that's fair. Thank you, George. So George sent me a question earlier. He was asking me about how, when a child gets something like dialysis, he says he has seen adults who are on dialysis, for life, or sometimes for a short time, and how it interferes with their health and how strong, quote unquote, that they are. Do children also suffer, even if it's acute, do they suffer any after effects of the dialysis? Like, are they still energetic children? Are they any strong children? He's asking if the kids who come for dialysis in Komfanochik are able to return to school and live normal lives, so to speak.
Yes. So the chronic kidney disease that they have in itself, makes them very weak. Because generally their kidneys are not working well, so they're accumulating lots of toxins in their blood and all that. So that in itself actually makes them very weak. They are not able to, and they don't have a lot of energy. So what a dialysis does is that it's removing these things from their blood. Yes, so they can go, dialysis sessions are usually about three times a week. Yes, so they can still go to school. They, when it's time for their dialysis, they come for their session, then they go back. Yes, so we have our patients on dialysis, they come from the house. So they come from home, receive their dialysis, then they go back home, continuing with their lives. Yes, so it's very good for them.
Let's say for the acute cases, we usually do the peritoneal dialysis for them. And for acute cases, usually the kidneys are able to recover completely. So for such patients, they can actually go back to school. because the kidneys have recovered. Those are for the acute cases. So once they go back to school, but we require that at least once a year you come for review so that we see how your kidneys are doing. Because once you've had an injury of the kidney before, international recommendations show that you should be reviewed or followed up for the rest of your life so that we monitor you and see how the kidneys are doing. So for acute cases, when the kidneys recover, yes, they go back to school and they do like any other person, but then they come back yearly for reviews. We follow up on them.
And then, Gina, okay, I will read your question a bit later. Let me re-announce the phone line: 0541 022 318 0541 022 318. Focus comes back and is saying that why do you allow your child to go through dialysis for a long time before they die, but when you can consider euthanasia? He's saying, is euthanasia an option since the financial, psychological, and emotional trauma is hectic? Esther, I saw you shaking your head. No, but Esther, you see, realistically, like you see the child suffering.
There are ethical considerations, and that's why we are professionals. Okay, we don't do things based on emotions, and sometimes you have to do things professionally, okay, and legally as well, because you may think, like he's saying, the child is suffering, you may want to, but you may end up getting into trouble.
Yeah.
Okay, so you have to do things based on the ethical principles, okay, and then based on the legal considerations as well. So that's what I can say.
And to add to that, we take an oath to preserve life.
Exactly.
Yes, as much as possible. So having that option of going to euthanize the patients because of having to be on dialysis for a long time is something that in itself is not right. So for some of the patients with a chronic renal failure, for some of them, they are not able to, they won't have the financial means to afford their dialysis. So in that case, we have palliative care teams that we refer these children to so that they can help them palliate the condition so death comes naturally. Yes, so for the option of euthanasia, that's a out.
So yes, that is for you focus. I think that sometimes, yes, I get it. Seeing the child go through challenges and the child is not doing, especially when you have other children who are seemingly fine and there's nothing wrong with them, and then this last baby that you wanted to put into the picture is now the one that is having all of these issues. Sometimes people tend to give up. And I know Confanochi does a lot of multidisciplinary stuff, and you have psychologists and all those people. At a point in time, we used to have priests. I don't know if we're still there. They're still there, yes. Yeah, I think we used to have people of the faith come around and talk to people. But, if you're a church group, Sunday after church, and just go to Confanochi. Just go to the children's ward. Let me be a kids advocate today. Just go there, go and spend time with them and all that. It sometimes relieves people of a lot of tension and a lot of pressure. It's not about going there to give just money, or sometimes it's just your presence that makes somebody's burden a bit lighter. 0541 022 0541 022 Someone is asking, how do children get hypertension? The world is no wicked. Okay, how do children get hypertension? Like, what have they done wrong?
So for children, most commonly their hypertension is from the kidneys. So one of the functions of the kidney is to regulate the blood pressure. So if there's a problem with the kidney, then the child will become hypertensive. Unlike in adults, where we have a lot of them having what we call primary hypertension or essential hypertension, where their blood pressures are high. and we don't have a secondary cause for that. Usually for children, a child having hypertension is usually of a secondary nature, and a lot of times the culprit organ is the kidney. So if a child has hypertension, it means that most likely there is an issue going on with the kidney. Such a child needs to be evaluated to find out exactly what is wrong with the kidneys, and not just putting the child on blood pressure medication, because it's a secondary thing. So you need to deal with what is causing it in the first place, which is most likely the kidneys. And there are other things, some cancers in children can cause hypertension, some hormone issues can also cause hypertension in children, but commonly it's the kidneys. Yes, so children do get hypertension. We see them a lot, and a lot of times it's from a problem with the kidneys.
Good morning to you, my very good friend, Baswa. So Baswa is saying that one of my friends' child was diagnosed with nephrotic syndrome, and she's saying that was the scariest condition she had ever seen. Thankfully, the doctors were able to sort it out, and now the child is doing so well. Says thank you to the doctors who take care of kids who have kidney diseases. And he's saying that the nurses and other people on the ward really encouraged us because we had given up. But it's a very dramatic condition. Like when it starts, and then when they're getting better, you see them improve. Yes, you see them improve. So that's why, yes, I know sometimes it was one of the cases that if you're a medical student, you have to clerk if you're doing pediatrics. I hope Dr. Akoi is not chasing the medical student to clerk these things, to clerk these cases every day. But there we go. 0541022318, 0541022318. Desmond wants to know that are the kinds of things we're putting in our kids' foods going to put them at risk of kidney disease in the future? Looking at the quantity of sugary foods and drinks that we put in our kids, but it's not our fault, Esther, that we put in their lunch boxes. Like, should we be thinking about those things now as we're preparing them with all of these fast food and junk food and all these things? Should we be thinking about it now? Will it have an effect on them?
It will. And we actually have to avoid, as much as possible, avoid those types of foods, because it doesn't help. We need to let our children eat balanced diet, what we call balanced diet, lots of fruits. And when you train them from the beginning, they actually get used to it as they grow older. So this is the time that we actually have to train them with taking a lot of vegetables, lots of fruits. Okay, there's sugary things that once in a while, and that's what I do for my children, once in a while.
It shouldn't be every time.
Exactly, once in a while, so that at least they also feel a bit pampered.
The children, are you listening? It's not every Saturday. It's like once
a balanced diet is key.
It's key.
Because when the sugar content is so much, they actually get clogged in the blood vessels that actually filter, in the kidneys, that actually filter the urine. So it sort of causes a lot of problems for the kidneys as well. Okay.
Good morning to you, Bernard. Bernard is saying that my child has been diagnosed with urinary tract infection twice this year. Listening to you now, I'm worried. Are urinary tract infections linked in any way to kidney diseases in children? But Dr. Akoi, so what is a urinary tract infection, and is it linked to a kidney disease?
Yes. So a urinary tract infection is an infection that happens within. So as we described the urinary tract before, we have the kidney, then the kidneys will make the urine, then it goes into these tubes going all the way down to the bladder. So the bladder will then store the urine. When the person wants to urinate, it comes out through the urethra. So that is the urinary tract. So any infection that happens anywhere along this tract is what we call a urinary tract infection. What it simply means is that germs, or what we call microorganisms, usually bacteria, have found their way into the urinary system and have established an infection over there. Okay. Commonly, it's the bacteria that is found in our intestines. Yes, they are usually the culprit bacteria. They are able, because of how close the intestinal system is to the urinary system. The organisms are able to find their way from the intestines into the urinary tract to establish the infection there. So we have what we call the lower urinary tract, which is from the bladder to the urethra, and then we have what we call the upper urinary tract. So the infection can happen in the lower urinary tract, or it can happen in the upper urinary tract, yes. So lower urinary tract infections, the child would come with certain complaints. He urinates very frequently. So when he's there, he goes to urinate, and then in just a few minutes, he wants to urinate again. He has that urge to urinate frequently, and when he's urinating too, he can be experiencing pain on urination. The upper urinary tract infection is more dangerous and more serious, because then for that one, the child will have a fever, the child will be vomiting, the child will be very sick. And for that one, it has a complication whereby, because the infection is happening within the kidneys, okay, what we call the renal pelvis, it leads to scarring within the kidneys. So it causes damage to the kidneys. So after the infection has resolved and healed, it leaves a scar behind in the kidneys. And that scar that it leaves behind in the kidneys actually affects the kidneys' function. So over time, the child is set to, if he's unfortunate, to develop a chronic kidney disease as a result of that. So in this, especially if it's a recurrent urinary tract infection, that means that every time he gets it, a scar forms, then he gets again, and that scar forms, it can damage the kidneys over time.
Wow.
Yes. So with the one who asked the question that the child has had it twice in
this
the year,
year,
I think it's very important for, especially if it's a male child, to have an ultrasound done, just to evaluate the urinary tract from the kidneys to the ureters and the bladder, just to take a look, because sometimes they have these congenital malformations we talked about, and they are one of the things that predisposes to getting a urinary tract infection. Yes. So if he's getting it on a recurrent basis, then it's really important to do that evaluation. Just start with an ultrasound, just to look, to make sure that there's no congenital or anatomical problem there, and then we take it from there.
It's quite interesting. It's quite interesting. So don't take the UTIs that are diagnosed in your children lightly.
Yes.
I think that's what I can say. We have a text saying, "Good morning, I'm Hamidu inside of Fenso," saying that my 4-year baby girl usually complains of sore-like pain when urinating.
So that could be a sign of urinary tract infection.
That could be a UTI.
So you should get to the nearest clinic or hospital.
But you see, like, 4 years, girl, produce urine. It's going to be a fight too. Like, it's going to be very difficult.
Well, from my experience, we don't usually get...
Your kids are good.
Even at the hospital.
Your kids are good.
we actually do not...
I have seen a child, the mother was saying, Johnson, the child said no. So the mother moved the bottle away.
Maybe it depends on the environment. You see, they usually feel shy.
Okay.
They feel shy a lot when they are in the midst of, a lot of people. But if you move them to a place where they have their privacy, sometimes we think they are kids, but they actually feel shy. So you take them to a place where they are alone, or they are with people that they are familiar with, and then they can easily produce a urine.
So Hamidu, I think it's important that you take your child to hospital. Often, so you have the Offenso hospital there. Really, St. Patrick's. It's a really good facility. Go, and I think they have a pediatrician. I think they should have a pediatrician. Yes. Go and see the pediatrician. When you go, all the nurses at the children's ward, tell them that this is what is happening. Talk to the doctor. And like I always say, explain why you are there. to the medical personnel that you see there, and they'll do all the relevant things. Okay, if you're not satisfied with what has been done, go back and see somebody else in the same facility, so at least there's continuity. Usually, I think what patients don't really do well is to see a different person in the same facility. They'll go to a different facility, and the same thing might be repeated. So just go back and see a doctor, see a nurse, explain to them what's going on, let them do the relevant labs. If it's a urinary tract infection, yes, they'll give you the right kind of medication for the child. If it's something else, like Dr. Akoi said, they'll do all the other follow-up investigations that can be done. Someone wants to know, what is the status of kidney transplants in Ghana now? He says, I've heard one was done recently, but has any been done on children here in Ghana? I don't know.
Yeah, I know of one that, but not in Ghana.
Not in Ghana.
Yes.
Okay.
It was done outside.
Outside.
So, but we'll get there gradually.
Like somebody said, we have chair. But can an adult donate to a child in terms of kidney?
Yes. An adult can donate to a child.
Oh.
Yes.
In most places outside, I have seen mothers or parents donating to their kids. Yeah.
Oh, okay. That's good. Hamidu comes back and says, I sent her to the hospital and they gave her an antibiotic and it stopped. But later she started complaining again.
So it's also important, I think like Nurse Esther said, usually for girls, if the perineal hygiene is not being done well, then that could predispose her to be getting frequent UTIs. Yeah. So how she wipes herself after she uses the toilet. Yes, so it's something that needs to be addressed if that is not going well. So it's always important to actually wipe from the front to the back. Yes, for the girls. Yes, so that's, because if that is in the opposite direction, then you'd rather be bringing the bacteria from the anal region into where the urinary tract is, and then that would cause her to be getting recurrent infections. But if the perineal hygiene is good and she's still getting recurrent infection, then she needs to do imaging. She needs to do an ultrasound just to make sure that there's no congenital anomaly within her urinary tract, which could be what is causing her to be getting the recurrent infections.
All right. So it's important that we pay attention. Let me repeat. We pay attention to our children when they start complaining about pain with urination. Pain especially in their flanks. Someone sent a message. I think I just forgot it. He's saying that kindly sound the alarm, especially to boys, that when they are playing and they are kicking each other, they should be mindful. They shouldn't even be kicking each other in the first place. But we know. But because of where the kidneys are, like they're on the flanks, they're on the sides, they want to do all these action things that they see. Your child may kick somebody and probably end up damaging their kidneys, right? Because trauma, that's happening. It was a message that came earlier from a very good teacher friend of mine that one of the things that scares her most is to see boys. I don't know why you're hating on the boys. Boys kicking each other on the playground. It's a boy thing. It's a boy thing.
They should generally take good care of themselves when they are, because any part of the body, even the head also can affect the brain. Every part of the body. So they should be careful when playing so that they do not hurt any vital organ.
We have a colleague who is listening saying that even sometimes children who come to hospital with what we call low HBs or anemias, it could be linked to the kidneys, right?
Yes.
Yeah. Ooh.
Yes. So when I was talking about the functions of the kidney, I mentioned that the kidney actually plays a role
blood production,
in producing blood. Yes. So and usually it's when the kidney disease has progressed to the chronic stage, that is when we begin to see the effects on the HB for the patient. Yes. So if any child who comes with anemia as part of our evaluation, we really need to also think about the kidneys and not just think about maybe an infection or think about iron deficiency or think about issues with the bone marrow, but we also think about the kidneys as well, because it could be a manifestation of a chronic kidney disease that a child may have.
So if the child is usually pale, you observe that the child is usually pale, weak, he gets easily tired and all those things, you could actually bring the child also to the hospital. We don't have to wait for the child to be very sick.
Okay.
As in, he cannot, not only when they are feverish or when they have fever or there is, but when we observe also that they are pale, sometimes you can observe that your child is very pale. The sclera of the eye is so white. Sometimes the palm is very white. You can see that the child is pale. He feels tired. He's not able to concentrate at school. He's weak. You can actually bring that child for assessment also.
So let's not narrow it down. Sometimes it could be more than just the normal. It could be something else altogether. And I think it's important that we look at that as well. And that's when you go to hospital, take your time and, you know, let the team do what they have to do. You know, don't be in a rush to I don't know, to leave the hospital, because you have come to the hospital essentially to get care, essentially to get help. I think it's good that when you go to hospital, you give the team a chance to take care of you. Sometimes people come and they have their own, you know, there's nothing wrong with reading up around the condition and everything, but allow the team to work, especially when it comes to things like urinary tract infection and kidney health for your children. Good morning to you, Maud. Maud is saying that Dr. Jima and team, how much salt is too much salt for a child? I knew this thing would come. So, how much salt is too much salt for children?
So, you know, when we talk about restricting salt, okay, I think a lot of times most caregivers think about, okay, it means that I have to reduce the quantity of salt I'm putting in my food or my food for the child. But there are certain foods that naturally are salty.
Okay.
So if you pick something like sausages, you know, pizza, you know, all the...
Akoi, you're in the spirit this morning. You're mentioning the things.
What we term as junk food in a way. Yes, they tend to have a lot of salt in them. So for those ones, as much as possible, just cut down on those ones. If you are cooking at home, and you don't put any salt at all in the food, obviously the child will not enjoy the food and you won't be able to eat it. But don't put too much salt in it. I mean, in terms
measure
of yes, the how to quantify that. For that one, you when you taste food and it's too salty, you know it.
You know, like just measure it. Don't just throw the salt inside the food. You know, people just I don't know. Why is it that we don't measure these things?
And sometimes others too, after cooking, they are like, oh, the salt is not enough. And then at the table, they add a bit of salt.
But when you do that, as an adult, your child is going to copy.
Yes,
exactly. Which is not healthy at all.
So just, you know, like, just measure the thing. You see, when you watch cooking shows, you know, they say half a teaspoon, a quarter of a they measure. We just pick the thing and drop it inside and hope that it tastes good. Let's measure. I mean, like Dr. Akoi said, it has to be on a certain rational level. If what you are adding to the food maybe is salted fish or something, you know you're already putting salt in the food. So there's no hard and fast rule about it. You just need to be a bit more conscious about what you're giving your child. And of course, the junk food. The pizza, the chips, the you know, all those the sausages, the Kobe's and all those things. You know, we're not saying don't give them to your children, but know how to give it to them properly. You know when to buy junk food, know when not to buy junk food, and pay attention to your child's health essentially. just pay attention to your child's health. Your child may be putting on too much weight, and you should pay attention to, or too little weight, or they may be getting dehydrated, like Esther said, like they've had some diarrhea, some vomiting, and you haven't even replaced the fluids that the child is supposed to have replaced. Please, kidney disease in children is not a joke. If you want to see how devastating it is, go to Konfanochi before, and you realize that it is not a joke. The whole world is usually full, as I remember it. Yeah. It hasn't changed there. No. Oh, you should change some more. That world is almost always full, and we are 3 minutes from 10 a.m. here this morning. Any final words before you go? I'll start with you, Dr. Akoi.
Yes. So, like we are saying, it's always important to bring the children to the hospital to have their kidneys evaluated. A urine test, a blood test can give us very vital information about. And then the science that we talked about, once you notice them, quickly bring the child to the hospital. And this is also even to the adults as well, especially if you were born premature. You naturally have very small number of cells in your kidney. So over time, you are likely to develop a chronic kidney disease later on in life. So it is something that anytime you are celebrating your birthday, always check up on your kidneys.
Yeah, that's true. Esther?
I would like to say a very big thank you to Orange FM for this opportunity. I would also like to thank the team that we work with, our bosses, Professor Samson Entry, Dr. Enimato Brasafo, Dr. Nane Kuya, Bakuma Ajimana Pia, and the wonderful nurses, the renal nurses at the Konfanochi Teaching Hospital. Sister Abigail, Sister Anna, Marian, Veronica, all the wonderful nurses doing the wonderful job at Konfanochi. God richly bless you.
We thank all of you for the work that you're doing at CATH, and that brings us to the end of our show this morning. People have thoroughly enjoyed the discussion on kidney health in children. Someone says that the team should come out more and not come only during World Kidney Health Day. I know, but they're busy people. My guest this morning has been Esther Obeng. She's a specialist renal nurse at the Konfanochi Teaching Hospital. And Dr. Akoi, who is a fellow in training at the Konfanochi Teaching Hospital. Of course, I'm here every Saturday. My name is Dr. Kwesi Jima. Show was live thanks to Oliver and ably produced by Alyssa. We're back on your radio next week Saturday from 8 a.m. to 10 a.m. with another exciting edition of the Orange Health Lounge. Enjoy your Saturday. It looks beautiful already. And stay safe out there and keep healthy. See you. Bye.